So that gives a risk of factor of about 1 to 2 plus X's. If it gets into an atypical ductal hyperplasia, and there are various influences which I'll talk about which causes all this, then it's called ADH, and then the relative risk goes up to between 3.3 to 6 times the risk of developing breast cancer. The same thing is happening in the lobular side also. This is the ductal side. When it is ductal carcinoma in C2, then there is a 10%, 10 plus multiple times of 10 that it can turn into cancer. And therefore, it is right from all these stages are preventable till it reaches this invasive breast cancer. Even at the ductal carcinoma in C2, one could arrest the tumor there. So basically, again, just to show you the various types of breast cancer, you have the ductal carcinoma, the lobular, and these are some very specialized types which I need not take you through. But to understand the biology of this cancer, we need to know that on the molecular basis, it is divided into 4 different types of breast cancer. If this is the normal cell and the genes, then they have been able to identify different genes that classify these tumors pathologically, molecularly, into 4 very distinct types of breast cancer. And those are luminal A, which is a very low grade indolent type of cancer, luminal B, which is slightly more aggressive. Then there is a HER2. HER2 gene is a gene that is present on the in the cells, which classify these cells into what are known as HER2 rich cells. And HER2 is a very specific gene which we need to know because it makes the breast cancer more less indolent, more aggressive, and we have an excellent antidote to this HER2 gene, which we have known as trastuzumab and now pertuzumab, and lots more targeted drug treatment that is coming up and targeting. I have a nice video later on to show you that. But it is very important to know whether a person is suffering from has a HER2 gene positive cancer or a HER2 gene negative cancer. The HER2 gene really is the target that the whole world is looking at because it makes this type of cancer very curable, because you have an antidote or an antibody towards against this gene. The basal-like cancer, and this forms about, in India, about 19 to 20% of cancers are HER2 positive. Basal-like is the largest number in India, unfortunately, which is not so in the rest of the world. So we believe that our cancers are slightly different from that occur in the rest of the world. 30 to 35% of our cancers are basal-like or triple negative breast cancers. And then you have this luminal A and luminal B, where in the Western world make up around 60 to 65% of breast cancers. But in India, unfortunately, that rate is low down at around 40 to 45%. And so we get much more aggressive breast cancers